May is a Mental Health Awareness Month. Do we know what mental health is? Are we aware of our mental health? And how do we understand mental health? And what are the key components of mental health? In this video, we will be discussing all of this. My name is Dr. Kulmeet Kundlas, and I'm a primary care physician for the last 25 years. I was trained in India and then residency in the United States. There is a big contrast how East and West looks at mental health. I have debated this topic for so many years because when you are grown up at a different place, you have seen mental health being interpreted and understood differently, and how we cope up with mental health differently versus when we are in the United States. There is a big discrepancy. I thought that I will divide this video into multiple parts, and I will go over what mental health is first. Brain is a master organ. Brain is supposed to get information from external world and our internal world and create output to react in our environment. Human beings have two more capabilities: memory of past knowledge and experiences. When we process the information, we bring our knowledge and experience into consideration before we act. This dynamic of modifying the processing of information, I think, is the basis of mental health. Two processes: to have previous memories, our ability to emote and feel, is what makes us unique. What is the difference between Eastern world and the Western world? Darwinian world of natural selection and survival of fittest, and Maslow's hierarchy of needs. They determine how an animal, and in this case human being, act and react in this environment. Maslow's hypothesized, and I think that's pretty much in line with Eastern world and Darwinian world. First need every human being has is ultimate desire to survive and preserve. That is your physiology. In terms of social environment, that is your basic necessities: food, shelter, safety. If that is not met, you have no time for mental health. And that's exactly what happens in Eastern world. When people don't have much, they have no mental health issues. As we progress, according to Maslow, once we meet our physiological needs, then we move on to our higher needs, that we need to make relations, we need to self-realize. But in Darwinian world, it is survival of the fittest. Reason we have more mental health issues in Western world because we have conquered our physiology. We have such a safety net that everybody gets fed, and the cost of food relative to Eastern world is a lot less in Western world. So once your stomach is full, now you could contemplate. And the brain does three things in essence. It thinks, it feels and emote, and is act. And the combination, or how much action, thought and emotions are playing a role predominantly in your life, will determine your mental health. That's why they say body in motion never feels depressed or anxious. But if you do not move, you become depressed and anxious. Let's take our emotions. Evolutionarily, emotions were not designed for us to feel good or pleasant. Emotions were our radar system. And the radar system is that whenever there is a threat in the environment, we will be informed. And the way evolution has wired our brain, all the emotional centers in the brain, they bypass your conscious thinking. They have extensive network of connection, very little processing time. Remember, in the essence, brain is an information processing computer. So the connections for the emotions get processed at priority, and they bypass your conscious thinking mind. Now, your thoughts. Thoughts are your deliberations. where you can bring to bear everything that happens, your past knowledge, your past experience, and you see the world in relation to that. Action is the ultimate output from the brain, and body is very honest. Body does not modify the things, body doesn't change the thing. Body is like a slave, just go by what directions or orders are given to the body. So whenever there is a problem, we can't blame our body. It is either thoughts or feelings. The paradox is our thoughts should determine our life. Our thoughts should govern our life. But we don't think. Brain processes so much information every day. So that's why brain has to automate. If you do something good, bad, ugly every day, brain will automate and it will make what you call it habit. It is an automatic program. So human beings are driven by autopilot. These habits are your autopilots. Now, thoughts should be conscious. Even when we are thinking, we are going stimulus and response. Very rarely we deliberate or create a space where we bring our past experience and knowledge. It is processed unconsciously. When we are acting, we are not bringing our conscious part of our faculties of the brain into bear. What we are doing is we are automatic loop. We see a stimulus, there is a response, brain did process the information, but there is no conscious component in that. In Western world, I think Dr. Joe Dispenza has it right. He has a very specific way he explained the things. He's focusing or trying to make everybody understand what we are. Ultimate product is emotions, and we could cultivate these emotions consciously. Before we get to that, if you are a thinking machine, you are a emoting machine, or you are an acting machine. And if you are not thinking, so basically you are left with your feelings and habits. If your feelings are more, or if you are a human being who has been driven more by feeling and not deliberating and processing the information as it's coming, you are basically a emoting machine. If you are more of a emotive machine, you are at risk to develop mental health issues. If you are a thinking machine, but you are unconscious thinking machine, you are a zombie. And if content of your thought is disorganized and bizarre, you are a psychotic. It is very easy to understand how this works. And there was one key component which is missing in Western world. Religion provides us a crutch by minimizing our worries and tension. If something good happened in Eastern world, God did it. If something bad did happen, it's God's will. But as we are progressing along Maslow's needs, we find we become analytical. We are not dogmatic. We are not driven by faith. That's why people who are religious or totally faith-driven, they're at peace with themselves. They're happy. They don't have conflicts in life. But people who are not driven by faith, or they're part-time like me, sometimes you're analytical, sometimes you're driven by faith, those are the people who have mental health issues. Now let's come to mental health. There are two main diseases which contribute to about 95% of mental health: anxieties or anxiety disorder and depression. What is anxiety and depression? Anxiety is worry about future. Anxiety is now in present, it's never in past. In past we have regrets. So anxiety is always about future. And who's worried about the future? People who are always worried about survival. If you have grown along Maslow's hierarchy of needs from physiology to connection, to self-realization and self-actualization. The way human being goes through their life, we start as selfish being. We want to survive. When we survive, we want to have a family. When we have a family, we want to get connected with the social world. When we get connected to the social world, then we start contemplating who I am, and we want to give back to the world. And then ultimate quest of everybody is, how do I survive even after my death? This is the journey of every human being. Once your feeling are predominantly is about future, you will be worrying about everything and all the time. You can't stop it, you can't control it, and then you have anxiety disorder. If you're stuck in the past and you have regrets of past, then you are stuck in depression. So anxiety and depression are feeling processing problem. This was a best way I understood it. I have seen this thing in action in every patient. Basically, when a patient comes to me and when they start talking about their feeling and emotions, for me it's very easy. I want to see whether they're stuck in the past or they are worried about the future. Other mental health disorders, they are very specific, but they should be managed by the psychiatrist. But anxiety and depression is 100% preventable, and 99% of the time your primary care physician will be taking care of them. And he has to understand you, because mind does not work alone. If you're feeling anxious or you're depressed, your whole chemistry changes. Your body is different in state of anxiety, state of depression, and that affects your physiology and lead to pathology in the body and different physical illnesses. We as primary care physician, I think, are in a better position to diagnose anxiety and depression and to treat them well and to correlate with your physical problems. In the end, anxiety disorder or depression is all about feeling. When your feelings are bigger than your thinking, you have mental health issues. If you don't think at all, you are psychotic. My goal in this video was to ensure you understand brain does three things. It thinks, it feels, and it acts. My goal was to make sure you develop a habit of thinking and not letting important things in your life to be automated by brain as habits and heuristics. You think properly and you feel in the middle, neither worried about future, neither worried about past, and live here and now. And if we start seeing the things here and now, you will find your all mental health issues disappear and you are in a lot more equilibrium, and you will have a beautiful sailing through this journey. I hope that this was helpful. Please like, share, and subscribe our channel. My name is Dr. Kulmeet Kundlas, and I will see you in next video. Thank you.